This is a routine mature cataract posted for a Phaco. I'm seeing more and more of these cataracts in these times. So after performing my incisions and staining the capsule with trypan blue, I go ahead and fashion my rexus with the 26 gauge needle. This is not a cataract which would warrant extra measures to prevent the Argentinian flag sign. All is going very well, as you can see. The other rexus is complete as well. It's a fairly large rexus, more than adequate. Go ahead. Although many times I don't do hydrodissection in these cases, I went and did some hydrodissection and rotated the nucleus as well. The problem being that this patient is a diabetic as well, and these cataracts can be leathery. I don't worry too much about mature cataracts most of the time, but when it's in a diabetic, you really got to be careful. So I've taken my sharp chopper and I'm at, I think, around 70% Phaco power, 400 millimeters of mercury vacuum and 40 ml flow rate. And I'm going to be performing the direct vertical chop in this case. So that's fairly a good chop, but you can see that central disc out there. So when you see that central disc, usually it means that the posterior part is still attached. So you are going to get a collar or a backbone. These cases, however, I don't worry too much. Just keep knocking off more segments. You can see, although a good separation, there are still fibers attached in the center. And you can see the difficulty the disc is already giving me in getting a clean chop. So I'm handling one heminucleus first, and still the disc is in the way. Now I've gone to the other heminucleus. I am hoping I can get a clean chop, or at least separate out this disc. There I've got it. Once you see that posterior tilt, you know that it has separated. You need just one or two segments to be cleanly separated, then the case becomes that much more easier. And you can see now I'm just picking it off like petals from a flower. This heminuclei probably has still some fibers attached within the center. So I first take off the disc. Look, the disc has come off. And watch this. Yes, it is attached. This is what happens when the disc doesn't allow you to get a clean separation. It's always a good idea to remove the disc, see what's going on, and then carry on with your segment removal. And that's it. I have taken out all the segments. It's come out well, in fact. Take my bimanual and start removing all the cortex. Sometimes this cortex can be a little bit sticky in the fornices. Don't persist too much. You may bring out the whole capsule with you. Once all is done, I am going to hydroimplant this single piece. It's a hydrophobic IOL. You just have to wait a bit for it to unfold. Once that's done, I put in my intracameral antibiotic, hydrate my wounds, and conclude the surgery. Thank you so much for watching.